Trust you are doing well. My name is Jason Maitland, and I am the chair of the IOSH Caribbean branch. And on behalf of the branch and IOSH, I want to welcome you to our session this afternoon, in which we'll be talking about overcoming vaccine hesitancy. But before we get into this evening's session, we just want to remind everyone about our housekeeping rules. We ask that you keep your mics muted unless you have a question during the question and answer session. You can keep your cameras on and off. Just be mindful of the environment that you are in. And of course, due to bandwidth on your particular side, it might enhance your experience if your camera is off and only put it on when you need to ask a question. Again, to enhance your experience, we ask that you put your view on speaker view. And we would like to encourage folks to ask one question at a time, or I should say one speaker at a time, just so that we ensure that everyone have an opportunity to ask their questions and be heard. We do have a question and answer session towards the back end of the session. So we ask that as we go through today's deliberation, if you do have a question, that you put it into the chat box as soon as it comes up, and that way we can ensure that we answer all the questions. If not today, then we can actually send out the answers to all the participants at a later date. As you would have realized, this presentation is being recorded. So if you are not okay with it being recorded, you feel free to send me a message, and we can see how we can then move forward with that. And for security reasons, the meeting will be locked at 6:15 p.m. So putting all of that aside, I trust that you're going to have a wonderful session this evening. Looking outside my window, this wet Wednesday evening. So on vaccine hesitation, it is my pleasure this evening to introduce our speaker, Dr. Nitya Raamkaransign, who is a family physician with practices in occupational health setting. She has a lot of experience in this field, having worked for a number of companies and organizations in supporting them in occupational health and wellness, and certainly in a time of COVID-19 has played a leading role in providing advice and support to a number of companies in the industry. Just a bit on vaccine hesitation before I hand over to the doc, and that will give her enough time to start to share her screen. Today's session is not really designed to deal with the legal questions or ramifications in terms of whether or not employers can make vaccines mandatory. There are a number of folks who have already spoken on that, including folks through the various arms of the governmental agencies. What we are going to focus on today is a recognition that as vaccines become more readily available, there seems to be a significant proportion of the population and the working population at that who, for whatever reasons, are hesitant to take the vaccine. So with that said, I now hand you over to Dr. Nitya Raamkaransign, and thank you very much for joining us today, Doc. Over to you.
Good afternoon, everyone. A special thank you to the IOSH committee for inviting me to be part of the discussion today on vaccine hesitancy, which is quite topical given the situation right now. Special thanks to Mr. Maitland for prompting my participation. And my What I hope to accomplish today would be to highlight some of the reasons why persons refuse vaccines and stimulate discussion on the strategies we can use to overcome these. So just a little about myself. My name is Dr. Nitya Raamkaransign, and as Jason mentioned, I am a family physician who works in an occupational health setting. I'm currently the co-owner of Fertility Medical Services Limited, which is a full-service occupational health provider. For the past year, we've been managing or assisting our clients with managing testing and case management for the COVID-19 pandemic. So I'm going to jump right into it and talk about where we are today, where we began. Trinidad and Tobago recorded its first COVID positive case on March 12, 2020. And for the first year of the pandemic, we managed to keep COVID at bay using our public health measures, our W's, wash our hands, wear our mask, and watch our distance. We experienced a first wave in August of 2020, which extended until about the 26th of September of that year. At that time, we had a 7-day rolling average of 100 positive cases per day. Subsequently, our public health measures again were tightened, and we found that we were able to control that spike. We experienced a subsequent spike this year, which began again in March and is continuing until the present day. This spike has been more serious because we had rolling 7-day averages of 400 to 500 cases. With the state of emergency implemented and the curfew, we have managed to reduce that by 40 to 50% to about 248 cases per day. And these figures are based on data provided from the 29th of June, which was yesterday. So part of this is that we've had successful control due to the public health measures. But what we did notice within this past week was a small spike in cases, which occurred over 3 days and then settled again. It can signal that the public is becoming a bit fed up, for want of a better word, to adhere to these public health restrictions or becoming complacent about them. And as such, we need to ramp up our vaccination drives to counteract and to balance this. If we were to look at our deaths, we had our darkest day on the 5th of June, 2021, where we recorded 31 deaths. We are down to a current average of about 10 deaths per day. And this is after over 8 weeks of the state of an emergency being in place and curfew restrictions. At the beginning of the spike, we had a 7-day average of about 5 deaths per day. We also had a positivity rate, and the positivity rate is simply the number of positive cases out of all the cases tested for that day. And we do not want to see that positivity rate, some scientific evidence say about 5%. At one point, we had a positivity rate of 38%. And this indicated two things. We were perhaps not testing sufficiently, or that we had a high rate of transmission, or a combination of both of those things. Once more, this really sheds the light and emphasizes why we need to pick up our vaccination drive. To our credit, we currently have had 212,774 people vaccinated as of yesterday. Of these, about 90,000 received the AstraZeneca vaccine and 122,000 the Sinopharm vaccine. This gives us some statistics of about 23% of our population having received 1 dose and about 6% receiving 2 doses. So it tells us that we need to pick up the pace with vaccinations, and for a number of different reasons. Primarily, we are looking at comparing now our vaccination rates with those of our Caribbean countries, as well as with the United Kingdom and United States. So we're looking at those, the UK and the US, as really a gold standard because they have achieved good vaccination rates, although it's not complete. So the UK and US have now received, now in a phase of complacency, especially in the United States, where younger people, there are vaccines available, but they're just not taking them for whatever reason. And this is an indication of vaccine hesitancy as well. Our Caribbean counterparts, Barbados, are doing a much better job than us, and unfortunately, Jamaica is lagging behind. However, Jamaicans are experiencing a better rate than we are in terms of controlling their infectivity rates. They currently have a 7-day rolling average of about 53 cases and about 5 deaths. And they have given about 250,000 vaccines. So if we compare their 7-day rolling average of 53 cases to ours at 248, say 250, we are in a much worse position in terms of the amount of COVID we have and cases that we are dealing with currently. So why is vaccination important? According to the WHO, the vaccines are a game-changing tool, but for them to be effective, they have to get into the arms. And with them, we should not give up our public health initiatives, which are the hand washing, wearing masks, and keeping our distance, because it's not the vaccines that will change the face of this pandemic, it's actual vaccination, getting them in our arms. So I'm sure everyone is familiar with this, the type of vaccines that are currently available, which are the mRNA vaccines, Pfizer, Moderna, viral vector vaccines, such as the AstraZeneca, which is available here, and the Johnson & Johnson, and the inactivated virus vaccines. These are traditional approaches to manufacturing vaccines, such as the Sinovac and the Sinopharm vaccine or Covaxin. So Trinidad, we have a lot of the Sinopharm, as we know, as well as the Oxford AstraZeneca vaccine. This is especially important because we are seeing the predominance of the Delta variant now worldwide, globally, and within our Caribbean and South American community. The Delta variant was originally discovered in India in December 2020, and it is possibly the most worrisome global strain at the moment. And this is because it's become more transmissible than the Alpha variant. The Alpha variant was the first variant of concern that was identified and cause of the initial pandemic. It is thought that the Delta variant is now 40 to 60% more contagious than this Alpha variant, and is the cause of almost all the new cases in the UK, 10% and rising of cases in the USA. In certain states, it's approaching 20% and will pick up pace. The concern here is that it is transmissible more easily than the other variants, which means that more people can get sick quite quickly. And in the UK, it's been noted that there is an increased risk of hospitalization within the first 14 days. It's also thought that the vaccines are slightly less effective with this strain, which is quite worrisome. And just to note that in the UK and the US, the persons that they're seeing in the hospitals are the ones who are currently unvaccinated. If we look at the efficacy of the vaccines with regards to the strain themselves, we can see that for the Delta variant, the mRNA vaccines, the Moderna and Pfizer vaccine, the AstraZeneca vaccine, and the Covaxin would be the most efficacious against the Delta variant. Initially, if we look at the Alpha variant, which is slightly less transmissible than the Delta variant, we had good effectiveness with the Johnson & Johnson and Novavax vaccine as well. And so the concern here is that those who are vaccinated can perhaps still get infections, which is being seen currently. Also, a major point to note is that reducing the transmissibility of the Delta variant is only achieved if you receive 2 doses of the vaccine. So we have a lot of people having received 1 dose, but after 1 dose, it's only 30% effective in reducing symptomatic infection. And we want to achieve more than 30%. We want 60 to 70% at least. And that's what we would achieve only with 2 doses of the vaccine. I thought that this statement by the Dean of Brown School of Public Health very, very noteworthy in terms of where we are going with regards to this Delta variant and our need to vaccinate. And he said, we are entering a time when being unvaccinated is going to become exceedingly more dangerous, and we're seeing that right now. Social distancing is becoming more lax. Mask wearing is declining. All of the public health protections that kept unvaccinated people safe before are now disappearing. And that's because people are getting tired of having to adhere to those rules. But the Delta variant is gaining momentum. Even in highly vaccinated areas, it may trigger outbreaks. The difference will be in those who are hospitalized. Those who are unvaccinated are going to be the ones who are going to be hospitalized, and we are seeing that. For those who are vaccinated, there may be breakthrough infections, but they're not going to be necessarily as severe. And so this is an important point, especially for those who have issues with the vaccines themselves, that yes, you may get ill having had the vaccine, but you may not get as seriously ill, and there is a reduced risk of death. So what is vaccine hesitancy? The WHO defines this as delay in acceptance or the refusal to accept a safe vaccine despite the availability of vaccine services. And this is an important point because in some areas availability is low. So we must look at that as a barrier or a hurdle to vaccination as opposed to a hesitancy issue. It involves a complex relationship or combination of factors that vary amongst individuals and populations. We have to consider the local scenario and the belief patterns as these are influences amongst acceptance rates. It may be a normal response to what is unknown, and there's many things that we don't know about the vaccine at this point in time. It also may be prevalent among races and class divides due to inherent health inequalities. We see this especially in the UK and US, where they found that some of the Caribbean communities, as well as Pakistani, Bangladeshi communities, have lower rates of acceptance. So why do people refuse vaccines? The main causes, according to the BMJ, and these were studies conducted in the UK population, which we can somewhat extrapolate to ours in terms of the Caribbean community, which was studied as a significant part of this. Misinformation, a lack of confidence, conspiracy theories, health inequalities, socioeconomic inequalities, which is more of a barrier, and complacency, and we have seen this a lot in the US. Health inequality we've seen in India, where some of the vaccines were given to private institutions and people were asked to pay for them. And obviously social disparities and finances would have hampered their ability to access those services. In addition, there are many bits of misinformation, such as in Trinidad, well, you're still getting sick, so why should I take that anyway? Or, look, the Prime Minister isn't taking it, why should I take it? All these conspiracy theories about who's taken the vaccine, who's had COVID, whether the vaccines are injecting a microchip. I've heard other medical professionals have those same and similar concerns. So it's across all categories of staff, all races, all classes, and education levels. So we have to consider our local culture, our Caribbean culture, and how does this feed into people's confidence in the vaccine themselves. So about 50 to 60% of people worldwide were willing to accept the vaccine. But what does this mean is that 40 to 50% of them do not want the vaccines. And a high prevalence of this was found in the UK amongst the Black communities, Caribbean Black populations, Bangladeshi and Pakistani communities, as I mentioned. It was also found that women were more unlikely to accept the vaccines. And this is important because this extends in a family to children who are eligible. Those who are eligible to receive the vaccines may also have lower rates of vaccinations. Lower education levels were also associated with hesitancy. Now, locally, we have no figures in the Caribbean community about the prevalence of hesitancy. Anecdotally, we can speak of within vaccination campaigns, for example, in the oil and gas sector, in the manufacturing sector, how many people were willing to take the vaccine and how many wouldn't. And it really varied company to company, I would say, but there were a large proportion of persons who did not want to take the vaccines, citing concerns. And we'll discuss some of those concerns shortly. And so the purpose of all of this is we need to figure out why people are hesitant to take the vaccine, and we need to formulate measures to move them from a position of hesitancy to confidence. So what are some of the perceived reasons? Well, health risks. People think that they may get ill with having the vaccine. They may get COVID getting the vaccine. They may get a positive PCR test by taking the vaccine. They may have lots of side effects. And obviously, locally, there's a lot of prevalence of concern with the blood clots associated with the AstraZeneca vaccine use. And this has been, by and large, the #1 reason for persons refusing that particular vaccine. In addition, they may prioritize other health issues. We've had patients who are diabetic, hypertensive, who would say, well, I need to do a checkup first. I need to do bloods. I don't think that might be safe for me because I'm a diabetic. When the converse is actually true, vaccines are especially important for vulnerable groups. And this is because these are the people who may get ill or get more severely ill. And so we want to give them some measure of protection to prevent severe illness and possible death. And further, there are others who are taking a wait and see approach. Well, let me see, let my neighbor take it, let my friends take it. Let's see how it's working in the local community before they decide to take it. And some of them think that by taking it, they may become more ill than actually having COVID itself. The second reason, and a major one, is that they simply have no confidence. It may be a lack of confidence with the science, concerns with safety or effectiveness, concerns about the side effects, concerns about unknown effects, because we truly don't have any long-term studies given the relatively short time vaccines were launched, albeit safely. But the population doesn't see it that way. They see it that vaccines are usually supposed to be studied for an X amount of years, yet we came up with one in less than a year. Therefore, something must be wrong with it. Additionally, there's lack of strong recommendations as causing confusion in persons' minds. Should they take it or should they not take it? We see this especially if we look at the UK, US, and Canada, who it's a global community now. Everyone has access to the internet. Everyone has a Google MD degree right now. And they are looking at vaccine recommendations from the top three, the UK, the US, and Canada. If we look at Health Canada in particular, they have wavered on their recommendations to their public. At one point, they were recommended the AZ vaccine. At another point, they stopped. At another point, they were giving Pfizer and Moderna only. And then subsequently, they've stopped giving Pfizer to adults, saving it for children, and giving Moderna as a second shot. They've also been mixing vaccines, something that we haven't done yet in the Caribbean, and simply because we don't have some of those vaccines available. Another big factor in our local population would be low trust in the health system. We historically have had issues with the health system, with stories of medical negligence, and there is a very low trust by the public in our health system. It's not something that we can correct overnight, but it's something that we can address by providing education and educating our health professionals as well to give the right advice and to support the patients who come to them for such advice. Lastly, there may be distrust of pharmaceutical companies as well as political issues. And so we have to think of the amount of respect that our politicians command in our public and in our general population, and think of how setting the right example or seeing how the politicians in some cases are taking the vaccine or not taking the vaccine may influence certain individuals in terms of their own personal decisions. Some of the other causes we can consider would be religious beliefs, lack of communication from community leaders. That's another level of persons having respect for community leaders. Apprehensions surrounding fertility. There was a lot of misinformation surrounding the vaccine and the vaccine causing infertility. Those who have had recent COVID infections may not take the vaccine because of limited access to vaccines. The cost of vaccines and their access to them, and we can look at that in our local situation where, despite being part of the COVAX initiative, we've struggled to somewhat get a steady supply, although this has sort of solved itself within the last couple of weeks. And as I mentioned before, there were concerns about the speed of the development of the vaccine. And these were all part of a survey that was done in the UK community. And as I said, it included the Caribbean community as well. So we can see and extrapolate some of that data and apply it to our local situation. So some of the hurdles which are different from hesitancy causes. Hurdles would be lack of access. And due to healthcare inequalities, which happens on a global basis, the access to the vaccines have been limited for some of the poorer countries and underdeveloped countries. We can see that the larger countries, the more developed and rich countries, in inverted commas, they have a greater access to the vaccines, especially the ones that everyone seems to want, which would be the Pfizer and Moderna vaccines. In some countries, there's racism and unethical practices, which leads to people not being able to access vaccines as well. And social disadvantages, lack of public health campaigns, and education are all barriers to accessing vaccines. So What are some of the things that will encourage people to accept the vaccine and have confidence? Studies have shown, and again coming out of this BMJ study in the UK, that social media, politics, religion, culture, accessibility, and trust are all very important in encouraging folks to take the vaccine. And the media especially has a great role to play in focusing and highlighting not only the negative stories associated with vaccinations, but the positive stories as well. We can look at certain countries, for example, who have had successful vaccination programs and show the differences between their society at present as well as ours. Everyone wants to move back to some sense of normalcy, and we can only achieve this if we reach that bit of herd immunity. We also have to consider local context, the belief and attitudes of our people, knowledge and awareness, our cultural traditions, the health status of our communities, and the health experiences that they may have. If we look at Caribbean communities, if we look at Trinidad and Tobago in particular, we know that health experiences are somewhat negative for some persons. In addition, access to healthcare is also limited. There may be limited knowledge and awareness despite social media campaigns, despite media campaigns in general. And part of this is because of the beliefs that we hold about vaccines, about medication, and about illness in general, as well as our attitudes towards those. So some of the things we note that encourage people to accept the vaccine would be the source of the vaccine. Let's start with that. People have a preference for a brand or type of vaccine. Anecdotally, I can tell you from the patients who have refused the vaccines under my care, they would prefer to receive one of the mRNA vaccines, Pfizer or Moderna. The vaccine scheduling affects others. For those who may have needle phobias, fears of medical procedures, having a one-shot vaccine would have solved some of those issues. Unfortunately, the Johnson & Johnson vaccine also had similar issues with blood clots, and this has affected its performance and success. The mode of administration, one shot again versus two shots or a shot in itself, there are some who would avoid those at all costs. Lastly, the knowledge and attitude of healthcare professionals. It's very important as healthcare professionals that, especially in times where anxiety might be at an all-time high, that we provide ethical and compassionate care to those who come to us for advice. We may see some very anxious behavior, we may see some very rude behavior, but we need to understand and put this into context of the person may have issues with accepting this, may be conflicted, and deal with this appropriately. So how do we address and overcome hesitancy? Well, it does require an interdisciplinary and a multi-tiered approach. If we look at the approach, for your purposes within an organization, you have a bit more control. You can reach out to your population, your staff, by your internal media, emails, and your media campaigns in general. But in addition, we can spread that out to your communities, especially where you have headquarters, and in rural communities, a national approach by supporting campaigns on a national basis. And overriding all of that, we need to have the policies in place from the government to support this. Interdisciplinary, we do need not just medical workers, we do need psychologists, we do need communication specialists. We've been utilizing the services of not only nurses and doctors, but paramedics, but veterinarians, dentists, to supply and to provide shots, because we are trying to get the campaign to a point where we can mass vaccinate persons. And this has been somewhat successful so far. In developing our strategy to overcome hesitancy, there are two things we need to be aware of. One, that no single strategy will be successful. It must be a multimodal approach. And secondly, success will never be 100%. We really just want to get that herd immunity, 60 to 70% of people accepting this vaccine, and we need to devise measures to achieve this target. So how do we get people to be confident in receiving our vaccines? The first thing we need to do is build trust with them. With regards to vaccines, the entire process, starting from the development, the licensure, the procurement, the logistics, the efficacy, the side effect profile of these vaccines, people want to know the correct information. There's a lot of information out there on the internet, but how much of it is really accurate? How much of that information is telling us what we really need to know? So we need to provide the information when we meet with people. We need to speak about the type of vaccines that we have, the brands that we have, where was it developed? Because these are questions that people do ask. When is it expiring? How did it get here? Who provided the vaccine? What can I expect when I take this vaccine? How am I going to be protected? Is it going to prevent me from getting ill? How efficacious is this? And as providers, as healthcare providers, we need to be honest. We need to show mutual respect and understand that not everyone will be on the same page with us. We need to be an authority and provide sound advice. And this is once more at many, many different levels. At a national level, we have authority from the PMO, the CMO, the Minister of Health. At a local level, we have the CMOH, we have private physicians, you have your company doctors, you have your health systems in place, and we can utilize services, we can utilize our providers in this manner to provide accurate information and compassionate care. We also need to have policies in place to support the vaccination and also to support those who may feel ill following vaccinations. There are some who may have to receive a vaccine and then go offshore to work and they may not be feeling well. So we need to also manage the way we provide the information, we provide the service, and also give folks some time to come to terms with what they have to deal with and also have some downtime if necessary. So planning and logistics, very, very important. Further on, how do we build the trust? Well, first we need to be very well informed. We need to study the vaccine literature. We need to know about the side effects so that we can have conversations with our clients. Building confidence amongst senior personnel. So in your corporate environments, for example, having workers see senior management receiving the shots, seeing their company doctor receive the shots builds their confidence to take the vaccine. Okay, well, if the CEO is taking the vaccine, it must be okay, so I should take it as well. You must also have confident healthcare professionals, whether it is your industrial nurse, your company doctor, your paramedic, even your HSC staff. Everyone knows about COVID, and we should provide information to them when they require it. This will inspire confidence among the staff to receive the vaccine and hopefully extend to their families. A great part of this approach is to build appropriate media campaigns, whether it be video, social media, print media, whatever works, really, whatever can get the message out there to the most amount of people in a safe manner, that really will help to spread the right amount of information. And in sharing this information, we need to ensure that the information is easy to understand. It makes no sense to quote statistics and use language that just makes people scared. We need to tell them things they want to know in a very easy manner. We must be prepared to answer many questions, address the myths and the hearsay, such as with microchips and other issues. We can show media runs or clips with influencers or people in authority or people who are respected receiving the vaccines. We also need to use the data effectively and underline the importance of the vaccine while dispelling those myths, such as ensuring that people understand that while the vaccine doesn't prevent you from getting ill, it can prevent you from getting seriously ill. We also need to share and emphasize the success stories of those who have those countries that have reduced mortality as a result of having great and successful vaccination programs. And we also need to set the goal and paint a picture of returning to normalcy. This will inspire persons to be part of the approach to return to normalcy, because everyone is tired of the way things are right now, unable to see friends and family and loved ones, to travel, to even share in simple pleasures, to go to a park, to exercise outside, and giving them some hope, giving them something to achieve will and can inspire them to consider taking the vaccine when they were previously hesitant. So in inspiring confidence, we need to be honest. We need to tell them we don't know about certain things and we know about certain things. We don't know sometimes some of the long-term side effects. This is a relatively new vaccine. We're not entirely sure how long protection lasts. We have good guesses and guesstimates, but in real life, we're not really sure how this is going to pan out. People will ask us whether additional doses are needed, and yes, they may be needed. It depends on the vaccine that you've received. And how may we be protected against variants of concern? And once more, using the information that we have about the current strain, the Delta strain, and its virulence really can encourage those who are hesitant to take the vaccine as well. In educating, we need to provide materials for reference to not only individuals, but communities. What do we know about the vaccines? We also need to let them know that the vaccines are needed to halt spread of the virus and allow us to return to some sort of normal living. We need to let them know that the vaccines are effective against variants, may not be 100% effective, but are quite effective. They all provide some level of protection against severe illness and death. They are very well tolerated generally with low incidence of severe side effects. And once more, going back to people's concerns about blood clots, we need to really paint a picture for them. We need to put into perspective the issue of blood clots. The risk of getting a blood clot with an AZ vaccine is 0.001%. This is defined as an extremely rare side effect. And even if those numbers creep up, it will take a considerable jump in those numbers for us to move up that recommendation. Vaccines are generally designated as having side effects that are rare, somewhat rare, extremely rare, or common. And the risk of the blood clots with the AZ vaccines, while we do understand it is a very serious side effect because it can cause death, it is not very common. We also need to re-emphasize that the vaccines are safe for adults, and for some vaccines are safe for children 12 years and older. And we need to remind that relaxed restrictions can occur, and we can pinpoint with countries who have had and received vaccination targets, they're somewhat returned to normalcy. Although there may be a bit of misinformation there as well, because at the moment we're seeing that the CDC is saying that masks may not be necessary, but some states are issuing mask guidance to continue because of the Delta variant. We move from confidence to inspiring action. And how do we do this? We have to reiterate the role of everyone, each person, each individual in preventing the spread of the virus, and the ability of each person to contribute to significant change and the change of our current circumstances. We have to reiterate the role and the success of vaccine programs in reducing deaths, and also inspire people to change and to consider using the vaccine as a part of looking out for our fellow citizens and protecting the vulnerable and the elderly and the young by becoming vaccinated. Some studies have shown that incentivizing vaccinations actually helps in increasing the uptake of the vaccine, and this is especially effective amongst younger persons, but at a corporate level may be something to consider. And it is an opportunity for both public and private partnership. But above all, we need to provide support for all of these initiatives. Private input into the public health rollout can occur in a number of different ways. Some have large car parks, a very large site, which is a good space to allocate for mass vaccination campaigns, to assist with advertising, media campaigns, and rollout of initiatives at a local level, at a community level, interacting with key community figures by assisting with incentivizing as necessary and where needed, logistic support for distribution, storage of vaccines, financial support as well at a governmental level for purchase of vaccines, and assisting with public health campaigns. Public health campaigns may have the greatest impact, but it should not be just only at a national level, but at a community level, interacting with communities, especially rural communities, as outreaches can help to increase the uptake of vaccines. Thank you for your listening time. And if you have any questions, I'd be happy to take them.
So thank you very much for that, Doc. A very thorough presentation, I think. Before we give folks an opportunity to ask their questions, and we really wanted to ensure that there was sufficient time for that. I'll be a bit selfish and go first. Having said that, this is not a question from me per se, but it's a question that I have gotten a lot from in our organization and from some of our service providers, some of our contractors. And I guess the first question is, if I have had the virus, do I still need to take the vaccine? Do I still need the vaccine?
Right, and that's a really good question. So the guidance from the CDC is that if you have had the virus, you should still take the vaccine. And the reason for that is that from what they've seen in looking at the antibody response and the immune response, when you actually receive the vaccine, there seems to be a higher and a more potent immune response, which leads to more memory cells being produced. And this is especially important in terms of us retaining the ability to fight infections lower down the road. So the current recommendation in Trinidad and Tobago would be to receive a vaccine about 6 months after having had the virus. And that's primarily to ensure that those who are completely unprotected receive the vaccines first, because we have an issue with a limited amount of vaccines being available at this point in time. But definitely there is no contraindication, and it is in fact a strong recommendation that you should be vaccinated despite being ill with COVID.
Okay, thank you for that, Doc. We want to leave the floor open. I will ask Rishi, who's our communications coordinator, to help us in this period in fielding any questions, whether it comes from the chat or if people want to, I will say, be brave enough by unmuting their mic and asking their questions. So the floor is open, folks.
My name is Rumi. Hello?
Hi, yes, go ahead, we can hear you.
Okay, I have a comment. Now, I am one of those people, I'm not fearful, but I am not going to be taking the vaccine, right? And I can understand why persons are refusing to also. The fact of the matter is, as a health and safety professional, I have been following this from the very beginning. And I have ended up in the hospital on numerous occasions from taking medication that has been existing for quite a while. Now. And doctors kept on saying, be honest, but there's a lack of honesty, because what you're providing the persons with is what the world government want persons to hear to take the vaccine. But the fact of the matter is that, for the exception of the Cuban vaccine, there are no other vaccines that are preventing persons from getting it, and also to prove that it is reducing the severity. And the mRNA vaccine, it has actually been proven in China that they had 2,000 persons that ended up in the hospital, and they're warning persons who have allergic reactions to stay away from taking those vaccines. We're talking about the blood clots, but we're also not talking about the fact that so it is up to person to provide all of the information and to allow them to make informed decisions on whether they choose, because it's a risk that a person is taking in taking the vaccine.
Thanks for that, Francisca. You cut in and out there for a bit, but I think we got the gist of your contribution. Doc, any feedback on that?
Yeah, sure. I completely agree with you that you should seek information from several sources before making your decisions. And by no means would I encourage, or I think that doctors intentionally set to mislead the public in any which way. We have to be careful as professionals in terms of what we recommend. And therefore, when we quote sources, we tend to quote sources that we know to be our scientific bodies. And this is evidence-based medicine. So a lot of the information that's out there right now, we would say there is some evidence, scientific evidence, but not all of them are yet peer-reviewed because we're still very early in this disease process. And so we continue to rely on those that have been historically scientific-minded and equitable and fair in terms of providing information to our clients. And so some of what you are saying, I do understand completely, but we can't repeat some of those ethically because they're not from certain standardized sources. So it may not always be an intention to mislead the public. It would be also that we are trying to provide information that we know comes from relevant sources.
Hi, Doctor. I'm just bringing up a question from the chat that participant was talking about persons having severe reactions to the COVID jab in terms of data in, that's out there, the number of persons who would have had reactions and it wasn't, adequately displayed, and also there were no long-term studies. But yet still we say it's safe. If you can shed any light on those 2 points.
Right, so we have no local data at this point in time. Data is still being collated and that information isn't available in the ministry, from the ministry, so I wasn't able to share that. The most common reactions would be localized reactions or COVID arm, which would be redness, swelling, itching, swelling at the injection site. And there may also be systemic effects, which would be headaches, fever, dizziness, chills, and then the more severe ones, which would be headaches that don't go away or shortness of breath. In terms of the prevalence of any of those categories, that information is simply unavailable from the Ministry of Health at this point in time. So it wouldn't be applicable for me to share that information at all. In terms of the US and in terms of the risk of clots, what we do know is that the risk of getting a clot with the AstraZeneca vaccine is 0.01%. And accepted risks we look at, as I said, we define them into whether it is common, uncommon, extremely rare, and serious. Yes, the side effects are serious. We're not doubting that. But recently, and this is the other thing, the reason why some of the information isn't there is because it's simply not there yet. We're still very early days in gathering the information. So when we're saying that it is safe, we're speaking from the perspective of that it's been about a year since the jabs are being used and we're looking at the side effect profile that we're gathering. Most recently, we see with the mRNA vaccines, Pfizer, Moderna, there may be some temporary inflammatory reactions, which can cause a myocarditis, which is an inflammation of the heart muscles. It does affect younger people, but it seems to settle. So when we're saying safe, we're looking at relative safety in terms of the risk of serious and severe illness when you have received COVID or you have had COVID. Because other than death, we are looking at a lot of people having severe morbidity and after having had COVID as an illness. So it's a relative thing in that we're looking at the risk of getting a side effect or an ill effect from a vaccine versus getting very ill with COVID and possibly having complications of that illness. So that's where the statement of relative safety comes about. And we can see that there is long COVID. There are persons who cannot simply return to normal living and have multiple effects that are yet unexplained. And that this is an evolving thing. So I can't expect, and I wouldn't lie to say that recommendations would change over time as things crop up.
All right, thanks for that, Doc. I see Mr. Jagdip with your hand up. If you want, you could unmute your mic and ask a question, Mr. Jagdip.
Thank you very much, Jason, and good afternoon to all. Doctor, thank you very much for sharing the information with us. I wanted to ask a question on the issue of herd immunity and the impact and its effectiveness on the general population, one. And two, what is the effect of herd immunity on the unvaccinated when that figure is reached, which we call herd immunity? Is it that the unvaccinated are going to be susceptible to the virus in a more direct way, or is it that because of the majority of the population being vaccinated, there'll be a reduction in the potential contracting the virus?
Okay, thank you for your question. So with regards to herd immunity, the purpose of this would be, in achieving this, we would essentially also protect vulnerable groups who cannot get vaccinated for any reason, such as allergic reactions or other health conditions. And so what we're saying is we want to achieve a level in the population where we'd have less and less persons getting ill. It doesn't mean it's absolutely going to go away. We would still have pockets of infection, but it's going to be smaller and more manageable. What it means for the unvaccinated is, and this is especially for the Delta variant, which is a concern right now, and we're not really sure how it's going to pan out, but what the theories that exist are that despite having high levels of vaccination in the States right now, there may be pockets of infections happening in the unvaccinated. And what we're seeing with that is that it may not spread, it may not get out of control because it's almost banded by the fact that it's surrounded by many people who have already been vaccinated. However, what it still can cause is an increased amount of death and disability as a result of the disease. And this is especially true for the vulnerable populations who haven't been vaccinated, such as children, and then the elderly or the ill. And so we are seeing, for example, our neighbor in Brazil, that about 1,100 children have died from COVID, and because this group is unable to be vaccinated. So they are they're capable of transmitting infection, and when they do get infected, it's difficult for them to survive or to remain healthy afterwards. So the purpose of achieving that is to reduce the levels considerably so that we can return to some level of normal living and protect our neighbors who cannot be vaccinated as well.
I wanted to ask a follow-up question. Thank you very much on the issue of the unvaccinated and herd immunity. Jason, can I go ahead and ask the second question?
Yeah, Dave, you can go ahead.
All right, thanks. With respect to some governments which are now proposing the use of a vaccine passport as part of the new normal in terms of everyday function and so on. This may be a very subjective question, so I will understand your own difficulty in answering it. The issue of how do we move forward as a society. The topic today is vaccine hesitancy. And I mean, even among my colleagues here this afternoon, I get a sense that there are persons who are yet to be convinced, including myself. And the issue, therefore, of if and when vaccine passport becomes a reality, is that something that we probably, because, and I'm being very, very cautious here, because of the need to move forward, people may be forced to take the vaccine against their will?
So if you look at the WHO's guidance on this, they're actually against a vaccine passport. And the reason for that is that the basis of medical ethics are two things I'm going to talk about, which is autonomy, which is the right to make your own decisions as regards to your body and health. And part of autonomy is that we provide you with the information and as well and as best as we know, and you make the decision on what you want. Now, making vaccine passports mandatory is conflicting with that. But another concern would be non-maleficence, which is do no harm. In providing a vaccine at this point in time, can we absolutely say for sure that we are not doing harm? The aim really is overriding good. We want to protect all our population. We want to prevent death and disability. We want to ensure that people can live healthily and happily, and not only physically healthy, but emotionally and mentally and psychologically. And we do know that COVID has had a grave impact on mental health worldwide. So the WHO's approach is that we continue to educate, we continue to provide the choice, and we continue mass public health campaigns for encouraging persons to take vaccines. I don't want to speak to the other nations, but the purpose, I guess, of them having vaccine passports is because they know that the vaccines so far have been able to reduce morbidity and mortality and help control the spread of the virus. And therefore, if people are going to be mingling and coming into their countries, they do want to ensure that they don't get flare-ups again. So it is not something that is supported. As I said, I'm using guidance from WHO and CDC, but as with individual countries, they are able to make their own decisions. And so it's up to us to decide whether we want to follow through on vaccinations for those reasons.
Thank you.
Okay, thank you for that, Mr. Jackdale and Doc. We have a question from the chat. What pertinent information can HSE professionals gather to disseminate to staff to reduce the reluctance?
So I think a lot of people have questions about the numbers. And so I would say, let's gather statistics. If we cannot get local statistics, and those may be slow in coming, simply because there may be a focus right now on getting vaccines and getting them out into arms. We will have anecdotal evidence. So I have been participating in a vaccine program for one of our clients, and we successfully vaccinated over 200 people with the AstraZeneca vaccine. Part of that process is where we fill a consent form, which elucidates information about comorbidities, age, gender, and any other health concerns, pregnancy, breastfeeding, if they've had other vaccines, etc. In addition, statistics are required to be sent to the Ministry of Health at every single closure of vaccine campaigns, and this would also identify those who would have had side effects, such as severe side effects. Mild side effects are not recordable and the information would not be there unless there's a public health survey. So I would suggest that HSE professionals provide information such as, one, what are the real statistics that we have available from reputable sources on the side effects of the vaccines, because that's the #1 concern, about the number of vaccines given, and worldwide or globally, we can use statistics right now for the incidence of side effects, the incidence of severe side effects, for example, the ability of the vaccines to prevent reinfections, the ability of the vaccines to prevent severe illness and death, and the ability of the vaccines to allow relaxation of social restrictions at this point in time, because these are all topics and areas of concern. Collating that information and providing the options that are available locally in terms of the type of vaccines, the brand of the vaccines, where they can access these vaccines, the possible side effects of the vaccines. And on one of the safer vaccines, if we were to look at it in that manner, the Sinopharm is available in Trinidad. It was formulated in the way traditional vaccines are formed as an attenuated viral vaccine. And so the side effect profile may be more tolerable, and the process of manufacturing that vaccine, for example, may be more tolerable to persons. And so we should provide options that are available and the information for each of those.
So thank you very much for that, Doc. I really do appreciate the discussion, the questions as well. We are running very much out of time. What I will want to encourage our members and anyone else who have joined us this evening is, if you do have further questions, if you just want some more information, feel free to reach out to us. You can also get us at LinkedIn. Feel free to reach out to the executive, any member of the branch really, and we will try our very best to get you a response to your questions. Like I said, we're very short on time today, so we just want to thank everyone for joining us this evening. Thank you, Doc, again for setting aside some time on your busy schedule. I know, as you mentioned, you are on you're continually on a vaccination drive, but I think it is important that as HSC professionals and citizens on the whole, that we have access to information, and we try to provide that information to people without our specific biasness, right? So, I mean, clearly, some folks are hesitant on the vaccine, some have no issues on the vaccine. As a body, IOSH and the Caribbean branch, we're just here to provide folks with the information and let them make the best choice that is in their interest. So thank you, everyone. I wish you keep safe and have a good night.